Joining us now is Dr. Andrea Stoner. She's a board-certified neurologist at the Michigan Institute for Neurological Disorders to talk to us about Alzheimer's Awareness Month this November. Dr. Stoner, thanks for being with us.
Thank you for having me.
Appreciate having you on. So more than 6.2 million Americans are living with Alzheimer's disease at this time. People have their kind of very general knowledge of Alzheimer's disease. It's one of those neurological disorders that we are typically hearing a lot about in our general society, but people don't really have a full understanding of the scope of this disease and how it affects different people in many different ways. So tell us some of the different ways that Alzheimer's affects many of these 6.2 million Americans living with it each day.
Right. So Alzheimer's is a type of dementia. So it is the most common type of dementia, and it's really characterized by a slow progression of change. So, we all know that the short-term memory is definitely first affected. And so most patients can say, oh yeah, I am frequently repeating conversations or asking the same questions over and over again. And family members are noticing that as well. So not only memory is affected, but as other parts of the cognitive domain. And that's, I think, something that we often forget about when we're discussing Alzheimer's, is that it can be very much behavioral changes and judgment changes that come along with the disease process that a lot of people aren't aware of.
We're joined by Dr. Andrea Stoner, board-certified neurologist from the Michigan Institute of Neurological Disorders, or MIND, joining us on the MegaCast to talk about November being Alzheimer's Awareness Month. And so, Dr. Stoner, you said it is a slow progression of symptoms with Alzheimer's disease. Generally speaking, when are people usually diagnosed, and when is this usually caught in a patient so they can begin treatment and being tracked to see these symptoms really progressing and know that this is Alzheimer's disease?
Right. So unless the family members have familiarity with a lot of the symptoms, sometimes the disease is not caught until later on. And that's why it's so important to spread awareness, because we want patients and family members to know what some of the early symptoms are. Like I said, it's a slow progression. So it's not something that you notice overnight. It's something that when you look back 3 months ago or 6 months ago, you could say, oh yes, mom or dad used to be able to carry on a conversation fairly well. And now I'm noticing that they're having hiccups in the conversation, or they're repeating the same stories that, I've already heard for the last several weeks. And this is something that, it takes families, 6 months to a year, sometimes longer, to really recognize those symptoms. And it's unfortunate when family members aren't in town and don't talk to the patients frequently, because a lot of these symptoms can go unnoticed for much longer.
And in terms of treatment, what are some of the typical treatments that Alzheimer's patients will undergo, and how effective are those treatments in either reducing the symptoms or slowing the severity of those symptoms over time?
Right. So we talk about both pharmacologic treatments for Alzheimer's and non-pharmacologic. And when we talk about medications or pharmacologic treatments, we focus on the disease process itself. And there are medicines out there that we know slow the progression down. So there's no cure for Alzheimer's. There's no way to fully stop it. But these medicines are approved, and they can slow down kind of, some of the memory changes or cognitive changes that we notice. The non-pharmacologic treatments focus on controlling symptoms. So, how can we make the patient and the family more comfortable with these changes that the patient is experiencing? And so, like I said, not only is memory affected, but sometimes behavior can become affected. And so patients need medicine sometimes, and different ways to cope with the behavioral changes, sometimes the aggression that comes with it, and the sleep disturbances that can be associated with it as well.
We're joined by Dr. Andrea Stoner, a board-certified neurologist with the Michigan Institute for Neurological Disorders, joining us to talk about Alzheimer's Awareness Month on the MegaCast. More than 6.2 million Americans currently living with Alzheimer's disease. And so in terms of the treatments that we just talked about, Dr. Stoner, what impacts those treatments and how they are, what impacts how those treatments are then utilized for one patient versus another? Does it differ based on the severity of the cases from one patient that may be maybe a little bit younger, maybe earlier on their diagnosis, versus someone that's a little bit further along in their diagnosis?
Absolutely. So it really is an individualized treatment, and there are medications for more mild to memory type changes or mild to memory cognitive dysfunction, and then there are medications for more moderate to severe. And the dosages also change. So we often start patients on lower doses, and then as the disease progresses, we increase the dose, maximize the medication before adding on a second agent.
I'm joined by Dr. Andrea Stoner, board-certified neurologist with the Michigan Institute of Neurological Disorders. And in terms of who gets Alzheimer's disease, you say it's the most common form of dementia. So who are the groups of people or certain people that are most at risk for developing any form of dementia, but particularly Alzheimer's disease? Or are there other risk factors that may lead someone down the line in their life to then later be afflicted with Alzheimer's disease?
Absolutely. There are, just age, unfortunately, is a risk factor, which nobody can avoid or control. But we know that when we get above 65 years old, the risk significantly starts to increase. And we also know that there is a familial component. There are genetic factors that can predispose a patient to Alzheimer's. So that is something that we take into account when family members can tell us, oh yeah, my grandma, my great grandma, et cetera, they've all had it. There are other factors that play a role too. Unfortunately, lower educational status to start with, that can be a factor at developing Alzheimer's. And patients with Down syndrome, we know that if they live to be a certain age, there is a high likelihood that they will develop Alzheimer's.
So you mentioned that some of the risk factors include a lower education level. With that being said, are there preventative tactics that people can employ earlier on in life, or depending on or really at any age, to prevent any sort of onset of any dementia, but especially or in particularly of Alzheimer's?
Yes, there are. We know that both physical and cognitive help can be beneficial. And so when we talk about physical activity, we usually try to say, get at least two days per week of moderate activity, and that's something where you are exercising for about 30 minutes at a time and increasing your heart rate. Obviously, we promote safe exercise. So for patients with Alzheimer's, a lot of them are fall risk, and so we want them to do exercises that are not going to increase their risk of falling, like being on a treadmill or something like that. We also focus on cognitive health, meaning we want patients to stay social. We want patients to stay out in the world and kind of, be in the setting where they're getting stimulated frequently. It's the patients who kind of are very introverted and stay at home, don't talk to anyone, don't communicate with anyone, that can be more negatively impacted. We do recommend that if you're not a social person, that's okay. You don't have to suddenly go out into the mall or public places. But if you're not social, then just try to focus on doing more things at home that can be stimulating for the mind, like puzzles, Sudoku, crossword puzzles. Those have been shown to be beneficial. Other things like reading, and especially reading things that are educational. You can sit down and read a novel, or you can sit down and watch a sitcom. That's not really stimulating for the mind. We really want people to be kind of actively thinking about what's going on. So reading the news, watching the news, kind of staying up to date with current events can be very helpful, not only for cognitive health, but also just to stay kind of basically involved with the day, the date, the month, the season. You know, those are things that patients often lose, and that's if they're actively participating in society or watching the news, they can hold on to that a little bit longer.
We're joined by Dr. Andrea Stoner, board-certified neurologist at the Michigan Institute for Neurological Disorders. And Dr. Stoner, if someone is out there and they are seeing some oddities with with a family member, with a friend, with someone in your life, they're noticing something's different or off with themselves, what are some of those common symptoms that they should be looking for that should onset them to either suggest for a family member, a loved one, another friend, whatever the case may be, or prompt them themselves to go seek the guidance of a neurologist or another expert and begin a testing process for Alzheimer's or another form of dementia? Yeah,
so obviously the short-term memory is something that we see frequently, or most commonly, and so when family members are noticing that is becoming more of an issue, you know, it's not like you or I, we walk into a room, we forget what we were doing, we walk out, and oh my goodness, what just happened? Do I have Alzheimer's? It's not that fast. It's not that quick. This is something that is happening kind of on a daily basis, and maybe starting to negatively impact your life, meaning if you misplace the keys and then you miss an appointment because of that, things like that are starting to interfere with your daily functioning. Outside of memory, other things to kind of be aware of or to look out for are changes in something that we call executive functioning. And executive functioning is kind of our ability to judge and reason, and also to be a little bit inhibited. So I know most of us can say we've all had the story of, you know, Thanksgiving dinner and grandma saying something a little bit inappropriate. And that is potentially a sign that we should look out for. So if your mother was very, you know, conservative, and now she's becoming a little bit more, you know, scandalous, that change in behavior is noteworthy. Another common symptoms that patients really do struggle with is not only a depression, but then a becoming apathetic. And that means that they just kind of stop caring. And so the patients themselves would become introverted, more quiet, and sometimes depressed. And so if you're noticing that with a family member, that's where you definitely want to bring them in for an evaluation.
And Dr. Stoner, around what age should people be looking out for some of these symptoms that may more commonly be pointing to something like Alzheimer's disease?
Yeah, usually 65 and older is when we start seeing first symptoms. And that's, you know, that increases with age. So the older we get, if you're 75, you got to look out for that a little bit more. And then 85, same thing. You know, not every 85-year-old is going to have Alzheimer's, but there is a higher likelihood that you will develop it the longer that you're living.
Dr. Stoner, anything else that would be important for people to know at this time about Alzheimer's or other forms of dementia or neurological diseases that they should be keeping aware of at this time, as we are in November, of course, Alzheimer's Awareness Month?
Yeah, just I want, you know, patients and families to know that there are options for treatment. And so, you know, if you have even a question of symptoms or a question of the disease itself, that, you know, we are, as neurologists and even primary doctors, can help answer those questions and then get you on the path for different treatments. And not, like I said, not all treatments are medications. Some of them are just more supportive therapy. And we have avenues to support family members as well, because as we know, the caregivers and close family members are hit just as hard as the patients are. So that's just to know that there's help available for them.
Dr. Stoner, thank you so much for your time.
Thank you very much.